We welcome in our special guest for the day. We are lucky enough to have Dr. Rob Warren from the University of Minnesota here joining us. Dr. Warren, this is our first time meeting actually here over this digital platform. It's nice to meet you. We appreciate you taking a little bit of time.
Yeah, thank you for having me.
Absolutely. And mostly we're here to talk about your research on fluoride exposure and cognition and studies that you guys have done. One in particular study that you guys have done to try and find any potential links between these two things. I'm wondering, could we start here? Could you guys just describe how, or could you please just describe how you conducted your research on this topic?
Yeah, sure. The basic design is to take a nationally representative sample of young people and compare the adolescent cognition of those who were exposed to fluoride and those who were not. And by exposed, I mean at the recommended levels, not crazy extreme levels, but the levels recommended by the CDC. These large cohort studies where you follow the same people over time are relatively rare, but there are some in the United States that we were able to use. And what we found was that the kids who grew up in places where the community fluoridated the water had IQs that were no better or worse than kids who were not exposed to fluoride.
Okay, so no specific connection there. I mean, and again, I love that
No,
you
they're
emphasized, and I want to re-emphasize that we're talking about those communities where there are normal recommended fluoride levels, right? Recommended by the CDC.
Right.
This is not covering places where elevated and extreme fluoride levels were uncovered. This is for those normal
Right.
areas. How does it relate to
Right.
cognition? And you
Yeah,
found
a
no
lot of
link.
the evidence used to argue that there's a big effect on IQ draws on evidence from small communities in places like China and Iran, where for weird geological reasons, there's massive quantities of fluoride in the drinking water. And those kids tend to have lower IQs than kids in a neighboring village. But that's not really relevant for the public policy debate in the United States, where we're talking about a small amount compared to nothing.
And I'm wondering, you used IQ as the means through which to observe whether or not the fluoride had an impact. I'm wondering how you landed on IQ and what other possible options you guys had to use to measure the effect on cognition.
Sure. Well, so we've actually conducted two studies. One used good old-fashioned IQ scores. One used standardized test scores in high school, so math, reading, vocabulary. Same result. We landed on it because that's what the public policy claims are. I came at this agnostic about what we'd find, but I heard people making the claim that fluoride lowers IQ, and I wondered, is that true? And I dug into the evidence that people cite when they make that claim, and it really isn't relevant to American public policy debates. And so I asked, could we do better? And that's what generated this research.
And when it comes to sort of like, in general, you guys have shown that there is no link here. Have you found, were there any variables that you observed in terms of maybe people who should limit their fluoride exposure, whether it be pregnant women or anyone with any specific sort of physical issues? Was there any information on that came out of your research?
Yeah, basically, no. I'm not a medical doctor, so I don't want to say, if you are pregnant or if you have some medical condition, do what you want. That's not my place to make such recommendations. Our research pertains to the broader population. In general, it is not apparently the case that children who drink water that has been fluoridated at recommended levels have anything to fear in terms of their cognition or their IQ being worse.
And you were your interest was piqued by observing this supposed negative link that came back to, or I guess even the negative impacts of fluoride, one that you have found no correlation with. I'm wondering, did you guys uncover any positive effects of fluoride exposure? Is there anything on that was included in your research?
Yeah, no, our work is just on the relationship with IQ because we wanted to investigate that public policy claim. But there is, I find there to be convincing and clear and overwhelming evidence that there are benefits for oral health, particularly children um, benefit from having fluoridated water, even in places where you get fluoride from other sources, toothpaste or supplements, things like that. It reduces the number of cavities. It reduces periodontal disease, and children suffer less and are able to concentrate in school, and they're healthier.
Yeah, and I'm also wondering, what part of this research did you find most challenging?
Um, the most challenging thing is combining all sorts of data. So to do this work, we needed archival data on when every community in America started to fluoridate the water. We needed to be able to link that to individuals' uh, cognitive scores, whether it's IQ or test scores, and we needed to do that for a national sample. And so that was demanding. There's high data needs. The upside of that is that it produces an answer to the question that should drive public policy decisions. The downside is it's not perfect, like any scientific study.
What imperfections did you find?
Well, we we're making some assumptions based on geography. So I assume that if you lived in a town that fluoridated the water, especially in the era before there were fluoridated toothpaste, we assume that you drank the water. We don't actually know uh, how much water people drank. We don't know whether they drank bottled water. We just know that people in communities where the water is fluoridated don't do any better or worse in terms of IQ than people in other communities. But we don't measure how much fluoride is actually in people's bodies, um, which is that would be ideal. Although that raises a whole nother set of challenges because fluoride doesn't last in your body very long, so you would need frequent and you'd really need a lot of biological samples from people to understand how their fluoride levels change throughout the day and over a series of days.
And I think my next question probably has a natural answer to it. I mean, we're all people, and you're studying how a certain additive impacts people. But I'm still going to ask, just in case it takes us, anywhere kind of
Sure.
unique. This obviously piqued your interest enough so that you wanted to take a lot of time professionally to study it. And as we kind of have alluded to, it's obviously something that has piqued the public's interest and has been a point of
Mm-hmm.
interest in American society for some time now. Why do you think this topic in general draws so much attention?
Yeah, this topic has been hotly debated since 1945 when the first community in the United States started adding fluoride to the water. It For the first 20 years, the nature of the debate was that it was seen as potentially a communist plot to infiltrate America by poisoning the water. It actually made it into Doctor Strangelove, which was a classic 1960s movie. Um, I think the interest comes from it being a public policy debate. Debates about, back when we debated the harms of cigarette smoking. Well, cigarette smoking was an individual choice. You could do it or not do it. Everybody needs water, and anybody in a urban or semi-urban area gets their drinking water from community sources. And so we are talking about the government. It might just be local government manipulating what is an essential product, and so that gets people's interest.
Yeah, absolutely. No question about it. It combines a couple different layers there when it comes to, government intervention,
Mm-hmm.
health and fitness and wellness. So all of that does combine to make a very, very interesting topic. I'm wondering, have you found in sort of all of your research that you do, have you found that there's a through line in how you pick your subjects? And do you have any idea on where you'll go next? And will it be, will
Yeah,
it have similarities to this?
it will. Almost all of my research is on how early life exposures to things like fluoride or lead or educational environments, how early life exposures and conditions shape long term health and well being, cognition, longevity, health. childhood is an incredibly important point in the life course, and it sets the stage for how the rest of your life unfolds with respect to health. That's what got me into this. But I also study a variety of related topics. With respect to fluoride, I don't know what comes next.
When it comes to that through line that you look to draw over and over again in your research of the impacts of certain things in adolescence and how that affects long-term cognition, is there anything about the act of drawing that through line that you repeatedly try to do that you can kind of uncover for us that maybe
Yeah,
we wouldn't have necessarily understood?
yeah. I think broadly generalizing, we, believe it or not, underestimate how important childhood is in different sciences.
Mm.
If I spend a lot of time hanging out with Alzheimer's researchers, Alzheimer's disease is a terrible disease. It's a huge problem, very expensive, costly to people's lives, of course. I'm coming to believe, and I think there's growing evidence that there are really important ways in which childhood conditions and exposures shape your risk of Alzheimer's disease. But when we think about Alzheimer's research and cures, we think about age 70 and beyond. We think the clock starts at age 70 and we need to intervene when people are already older and give them drugs. But I think there's far more promise in early prevention, in making sure that every kid has got a quality education, and making sure that nobody's exposed to lead, and making sure that people have access to healthy food and enriching environments. I think that has much more promise for curing long-term diseases, improving population health, delaying Alzheimer's disease, and so forth.
Yeah, that is very insightful. I mean, that preventative measures, preventative treatments, help solve the problem before it fully starts. It may be the way to go.
Yeah, it's difficult because people want to cure now because grandma has Alzheimer's disease, or I have cancer, or whatever. But you sort of need to also think ahead a generation. What can we do now to prevent this problem for the next generation?
Yeah, no question about it. Dr. Warren, it's been wonderful to have you here. I'm wondering if there's anything you want to add before we let you go.
Yeah, I mean, I would say, I don't know if communities in your area are debating this. Should we continue to fluoridate the water? Should we stop doing it? I would hope that those discussions take place in light of the best scientific evidence, both on the pros and the cons. The pros being benefits for oral health, the cons being claims about things like damaging IQ. I hope they take the best scientific evidence and not rhetoric, political or otherwise, on either side of the political spectrum.
Well, very good. Hopefully, this interview in some small way helps to continue to push that process, looking at the pros and the cons and everything that surrounds them contextually. Well, we really appreciate you coming on and joining us for a little bit here. And, hopefully at the conclusion of your next project, maybe we can talk to you again. But for the time being, thanks for spending a little time with us today.
Okay, thank you.
All right, that is Dr. Warren from the University of Minnesota talking to us extensively about his research on the impacts of fluoride on cognition, and the fact that ultimately his results found that there was no difference in changes in IQ based on fluoride exposure or non-exposure, and he's talking about exposure levels that are within regulation of the CDC, not places that have abnormally elevated fluoride levels, but places that have fluoride levels in the water that is within those bounds of regulation. His research has shown that kids in communities with that fluoride exposure have no difference in future IQ than those who are not in those communities. He also stated that the positive impacts of fluoride, specifically on oral health, are a factor as well. So that is Dr. Rob Warren's research. He's a professor of sociology at the University of Minnesota, joining us today to talk about that research on a topic that, like he said, has been hotly contested and debated here throughout the United States. So